Dawn Butler.
Thank you, Chair. Thank you, Secretary of State. Just picking up on that last bit that you mentioned, I think there was an issue with communication and systems that was used in the laboratory centres that you built and the universities and established public health mechanism which slowed down progress and communication and functionality. But I wanted to just talk about...
Yes, I'll absolutely acknowledge that. And I think that another lesson, another benefit that countries like South Korea had was they had the IT systems in place to be able to do a lot of this. And building those IT systems at pace has been a huge and very difficult effort.
What proportion of contact tracing is carried out by local teams?
Well, I will try to find the figures for you. We publish them we publish figures on contact tracing every Thursday, but the broad picture is an increasing proportion because we're getting the contacts to local teams as early as we can. But what I'm really pleased that we built the massive central capacity for contact tracing as well, because otherwise we simply couldn't have coped with the scale of contact tracing needed. And if you talk to my international counterparts about contact tracing, and we do, the ones who don't have a central system are absolutely tearing their hair out, because you need the massive central system and the boots on the ground who really know the local area. The key is the stitch up between the two.
Yeah, well, I think we found now that, which Long could have said in the beginning, that actually local tracing systems are much more effective than the national ones. But my constituency in Brent, for instance, have got a good programme that they're rolling out. How much additional resources have been provided to local authorities, for instance, to help with this rolling out of this?
Yes, so an additional £8 per resident per council has been passed over to support this effort.
How does that compare to what was given to private companies for contact tracing?
Well, a lot of that is in turn spent on private companies to do local contact tracing. So that you've got if you want to get a public-private split, you have to look at a different set of figures, because then you're looking at who is employed directly by a public authority as opposed to who is brought in by contract. And so, I mean, I can get that split, but it's immaterial. What matters is the service that you're delivering.
I agree. It seems like the local service has been better than the national service.
Well, no. So it's the combination of the two that works. You see, one of the reasons that the local service can work a lot better is, of course, because there's boots on the ground. But it can't do that without the national system taking the big numbers. So what happens is that the national system is the first to get engaged, and they can cover off around 60% of the contacts.
They do the easy ones, don't they?
Not necessarily. It depends on the circumstances of individuals. So, for instance, the local system does care homes, and care homes are much, much easier to contact trace than almost any other setting. The local system does schools, and schools get, if one person in a bubble in a school get test positive, everybody else in that bubble is a contact, and obviously that means that if you just look at the raw percentages, then the numbers look like you've done an amazing job. But actually, so contact tracing a school, contact tracing a nursing home is easier than contact tracing individuals, and those are largely done by the local area. So that's why this unfortunate attempt, which some people try, which I'm sure you won't, to imply that public sector good, private sector bad, or local good, national bad. Both of those things are completely counterproductive when we're trying to save lives.
Yeah, I think it's more public. You get much more value for money, and is much more effective, reaching 80%, whereas the private sector costs a lot of money and averaged out about 48%. So I think it's that the comparison should be. But thank you very much.
Well, I've described why those figures are not the right way to make the comparison, and the idea it's just unfortunate, and I'll put on the record after this exchange my thanks to all those working in private sector contact tracing, because I really dislike it when people try to do them down.